Hey everybody, Dr. Kumar here. Have you ever noticed how your eyes close when you sneeze? And if you've ever tried to stop it from happening, you'll know it's pretty much impossible. And there's a reason for that. The sneeze is a very complex reflex arc that bypasses your higher brain to maintain and preserve the mechanism of the sneeze. And that's because if you don't do it right, you can actually get hurt. So it's hardwired into our biology. Here's how it works. When your nose gets tickled, it sends a signal through the trigeminal nerve to your medulla oblongata, which is part of your brainstem. In the medulla is the sneeze center. And the sneeze center senses that the nose is being tickled and then sends signals out through your spinal cord to your diaphragm and all your intercostal muscles, those are the muscles between your ribs, to squeeze the chest and squeeze a large burst of air out of your lungs. And then the sneeze center will send signals to your larynx and your pharynx and your tongue to properly position themselves for the sneeze. In addition to this, it'll also send signals to your eyes. There's a muscle around your eye called orbicularis oculi. And this muscle is like a ring that closes down and your eyes shut like that during the sneeze. So why does that happen? Well, when you sneeze, you massively increase the intranasal, intravenous, and intraocular pressures and very momentarily. So much so that you can even rupture vessels within your eye or cause trauma to the eyeball from the violence of the sneeze. So when you close your eyes, you're essentially pushing back on that pressure wave to try to maintain some homeostasis in the intraocular space. So the sneeze is highly coordinated, and if not done right, can actually hurt your eyes. Anyone who's ever burst a vessel in their eye knows from retching or coughing too hard knows that this can happen. And next time you sneeze, just let it happen. Your body will take over and run it perfectly. This is the kind of stuff I get into. I love biology. If you want to know more practical things explained kind of like this, you should check out my podcast. It's called the Dr. Kumar Discovery. I release an episode once a week. Sometimes I tell stories, or sometimes I explain very practical solutions to common health problems. Anyway, I hope you check it out. Cheers.